We turn our attention now to a subject that strikes very heart of national development, Nigeria's healthcare. The revolution that we're seeing in the politics reshaping medical tourism. For decades, the phrase has been medical trip abroad. Some people even little headache, they're going abroad to get it resolved. We symbolize a loss of confidence in our system, our hospitals, some of which are dilapidated. Even the private sector, the public sector, all are the same. Loss of confidence also in our doctors and in our system, misdiagnosis, mistreatment, and all of that. But what if that tide is beginning to turn? What if world-class healthcare is no longer a flight away, but right here at home? Tonight we explore that transformation through the lens of Nizamiye Hospital right here in Nigeria, a leading institution redefining excellence in medical care, and the government's new drive to make Nigeria's medical tourism hub. Joining me tonight are Professor Dr. Ibrahim Yani, the medical director of Nizamiye Hospital, and Dr. Salma Ibrahim, and as a special advisor to the president of Health. Thank you so much, gentlemen and ladies, for coming on tonight on the program.
Thank you so much.
It's a feel-good segment on the program. The good news, I was one of those who think that nothing good comes out of the health sector in Nigeria. We've seen it over the time. People get diagnosed here and they go abroad and they tell them, who did this? They wanted to kill you. We've seen that happening over the years. Our hospitals are dilapidated. But what is interesting here, we're seeing a private sector and public sector working together. When government says, we are doing our own on our part, the private sector says, we are doing this on our part, how can we collaborate? Thank you so much, gentlemen and ladies. But let me begin with you, Dr. Salma. Things were bad, isn't it? But now, what is changing?
A lot has changed, in terms of the renewed hope commitment. The health agenda for renewed hope has changed. And we are beginning to see the changes. This is just about 2 years. A lot has changed because we made promises at the beginning, pre-election. We're very conversant with the situation of health in Nigeria. And we also believe that Nigeria cannot make any progress in terms of development without repositioning health, without recommitment to change the trajectory. So one key pillar is the reversal of the medical tourism.
How are you doing that?
We are doing that. It's a major pillar. The commitment is currently translating into action. One is around the areas of infrastructural development. Nigerian training is of standards comparable to anywhere in the world. And that is where when Nigerians apply for jobs abroad, they get it, even without visas, because they trust and they believe and they have confidence in the quality and standards of our training. So what we do is, how do we harness those talents back home in Nigeria? And how do we make our environment attractive and conducive for Nigerian health professionals to practice within the country? So there are lots of policies that have come into action in the last 2 years. One which I would like to discuss is about, reversal, of the local manufacture of medical supplies, medical equipment, basic medical equipment in Nigeria. So that, because one of the major attractions to Nigerians, they will tell you that we don't have the facilities in Nigeria.
COVID exposed us.
COVID, in fact,
simple nose mask, we could not.
Exactly. So it exposes the weaknesses in our health systems. I would say the fragility in the health sector. So what we have done is to reverse that. And you are aware of the executive order that was passed by His Excellency President Bola Ahmed Tinubu immediately when he came into office, saying that Nigerians should be able to produce more medical equipment. We should be able to leverage and harness the potentials within the country and attract more in the country. Another area is our human resources for health, though it is a global phenomenon. But what we have done, how do we attract back our health professionals that are already fled the countries? Of course, they fled for reasons best known to them, but majority will tell you that most of the pull factors, the conducive working environment, the incentives that they are paid there abroad, their career progression. So what we have done is to step up capacity development of our healthcare professionals, and also to have a pathway for them for career development in Nigeria, and at the same time improvement in the working environment. And this we have seen, especially in our tertiary institutions in the last 1.5 years. We have also seen a step up of action in our facilities, the partnership with the private sector. And most of our private sectors today are providing state-of-the-art medical services to Nigerians, even attracting more abroad. And we'll get to hear more about that.
So, I mean, it's so interesting. When I was speaking with you and when I spoke with Professor Yamis, and it's on the basis of a story that I heard of a woman who had a cancer and who had been diagnosed right away, I think in Canada, isn't it? And she came home and she got treated in your facility, and she's ill, she's healthy, and she's fine right now. Do you do magic at your hospital? Because no one will ever thought that that level of treatment and the stage at which the cancer got to was going to be resolved right here on Nigerian soil.
Thank you so much, and good evening, everyone. And thank you for inviting us. And I would like to warmly greet all our viewers. And I would like to say we are very pleased to witness the rapid and impressive growing healthcare investment in Nigeria. So Nizamiye is the part of this, the growing sector. We are here almost 11 years, and we are the private sector, but one of our hospital is the charity hospital. So, this kind of, the organization give us big benefit to make a big investment of the health sector. Our target is to improve the quality of the medical care, because we believe if the people can find the solution here, why go to the outside? Why go to the abroad? So we are trying to do this, and we are trying to bring the high quality medical equipment, technicians, doctors, and the other, you need to also the maintenance. So we believe everybody wants to get the high quality medical service. If any people has the same problem, everybody wants to best treatment. And this is the human right also. And so if we can give them to this chance here, the people cannot go outside.
Professor Yamis, there are very popular treatment that people go abroad to, apart from the aesthetic surgery where people want to enhance their bodies and all whatnot. Well, that it's 1 for 1 naira on the street of Lagos that you can find people adjusting any part of their body. That on a lighter side. But on a serious note, there are very popular reasons why Nigerians fly to Turkey, fly to India, fly to the United States, fly to Germany, and fly to the UAE. These are some of the countries that Nigerians go majorly for medical treatment. The question I would like to ask you, that cancer case that I heard of is just one. What are those critical areas that your hospital, for example, is paying attention to attract or make sure that Nigerians stay at home and get the treatment? Can we be guaranteed that some of these critical areas are being dealt with at your facility?
Yes. So there is a two part of this question. One part, okay, the aesthetic surgery or something is not life-threatening problem, but also the other side. There is some life-threatening problem. You can solve this problem in hours. Not you don't have any chance to go anywhere. And I want to give one sample. 3 weeks ago, the man has the abdominal aorta aneurysm rupture. In the world, almost 99% died, this kind of patient, because of it's very urgent case. You don't have any time to go anywhere. So this gentleman came to our hospital. In a few hours, we start the surgery, and after 10 days, he go to home. And the other issue, and the biggest issue in Nigeria, there is a heart attack, and you need to reach the correct center in a few hours. There is 2 hours and the golden hours. If the first 2 hours you go to the correct treatment, you can keep your heart muscles. So in our hospital, we are giving the service 24 hours, 7 days. We have 4 interventional cardiologists, in-house doctor. It's a big revolution
so
in
most
Nigeria.
of these things, renal, liver, kidney issues are easily resolved.
Yes.
But the pricing is another problem, though.
Sorry.
The pricing, some pocket friendly.
No, sir. You know, the high quality medical service and has some difficulties and has some needs to some high medical equipment, high quality medical equipment, consumables, and the person. So this is the eligible price. If you want to fly outside, you pay ticket and many things. Also, I told to one case, the first, this is the very advanced surgery. In the world, just only few hospitals can do this surgery. The other is very easy for us. The kidney problem, liver problem, interventional cardiology, we can do everything. We can close the ACD, VCD with the cath lab. This is very easy surgery now.
Before I come to Dr. Sama, let me ask, is it true? Are people coming into Nigeria for treatment?
Yes. Last year, 150 people came from outside.
Outside of Nigeria?
Yes.
To Nigeria?
Yes.
For treatment?
Yes.
Unbelievable.
Even from Canada.
From Canada?
From Netherlands.
From Canada, from Netherlands, and Germany, and also the Africa. There is many countries.
Africa, in fact, many.
Yes.
Interesting, because I understand, and I don't want to go into it, I understand that very prominent Nigerians and some leaders in Africa and Nigeria, they come to your facility.
Yes, because the facility is not the biggest factor. It's the, you must work with the high-level medical person. Doctors must be qualified, and your facility must be ready. In Canada, for example, the last patient came 3 weeks ago for the kidney problem. Almost 1 year, try to get the treatment, but he didn't reach the doctor and came here. In the next day, we did the surgery, and after 2-3 days later, go back.
Oh,
so it's another.
So sometimes
things are changing.
The waiting. Because abroad, especially developed countries, they have a long waiting list. So they find it much easier since the expertise is available in Nigeria and then the facilities are available. It's easier for them to come back home and have it here in Nigeria.
Yeah.
And then the cost also, you raise the issue of cost. It is still much cheaper, to be treated here in Nigeria, despite the what we feel that it is very expensive in the private health facilities. You have to pay for your transportation, and then you have somebody to accompany you. You have to pay for your hotels. But the major challenge that I discourage medical tourism is even the follow-up. It does not just end after the intervention surgery. You still have to be observed. You have to fly back to Nigeria. And then how do you ensure you have quality follow-up after surgery? And then the nursing care after surgery. So a lot. And then you find out that a lot of things go wrong and they are unable to go back.
I understand, and I must leak your secrets right on here, what you guys in the Ministry of Health are doing. I understand that you are working through the back door to help private sector also, because you know that the public sector cannot do it alone. What kind of intervention are you giving to
the private sector cannot do it alone. So it's a partnership. So we encourage private sector in terms of their capacity development also, in terms of regulations to ensure that they meet international standards of practice. And we also ensure that they also are certified by international accreditation, because that gives confidence to Nigeria when you hear that a health facility, a tertiary institution in Nigeria is accredited and certified of international standard, just the same certification that was given, for instance, to University College Hospital in London. So you have more confidence. Then why do you need to travel abroad to seek for medical services while you can have all the expertise here? And that facility has been fully certified.
And they pay in naira.
Standards. They pay in naira, not in dollar. And then you can easily have access to follow-up.
Give me a moment. We need to go on another break. Good news, I love it. In the sense that if you have anybody who has had any medical challenge and they've had to be flown out of the country, and some of them, whether they made it or not, it gives you some level of concern. But when you hear that news, and that's why I was interested. And so that's why I'm not bringing a government person alone. I'm bringing a private sector person. I have a very close person that I know that had a cancer problem, and it was resolved right here in Nigeria. And that's why we're discussing it tonight. But we take a break, everyone. When we return, more on what is changing in the Nigerian medical sector after this break. Much everyone. Professor Ibrahim Yamis, the medical director of Nizamiye Hospital, and Dr. Salma Ibrahim Anis, special advisor to the President on Health, both of them, one from the private sector and the other from the public sector, and we're analyzing reasons why Nigerians now need to look locally for healing. Thanks so much, gentlemen and lady. I was going to ask you, a lot of Nigerians, especially high profile, those who are in power, they run out to the country for treatment. Do we have what it takes to treat even the biggest of the biggest persons politically in Nigeria today?
Yes, I will say yes. We have what it takes to treat everyone in Nigeria in most cases. But you know, sometimes it's an attitude. People believe that they need to travel abroad, and sometimes they go.
People don't have trust in the system.
They travel for holiday. Most of them travel for holiday, and they match it up with medical checkups. And this is what we see mostly. I would tell you, we did a survey about 3 or 4 years ago when I was head of Department of Hospital Service of the Ministry of Health to find out why are Nigerians traveling abroad to seek for medical services, just like you said, for headache. You know, and then what came top on the list, especially those that go to India, is the nursing care. They say they have a dedicated nurse attached to them that takes care of them fully. While here, it's a lot of burden on a nurse to dedicate to one patient. So you have different reasons why they travel. But those were some of the factors that we found why they travel abroad for medical services. And then some would tell you that because it is a low cost to travel to those places, but what they don't remember, they also don't key in the cost of traveling and also the cost of follow-up of their ailments when they are back to Nigeria. So what we encourage, and we will continue to encourage, that Nigerians should leverage the opportunities that are available. When you mention about cancers, today we have, I would say, more than 12 cancers. These are in tertiary institutions.
What I know excluding 3 new cancer centers as of July that was announced by the president. Are they functional?
There have been existing 8 cancer centers as of 2022. These are additional cancer centers in our teaching hospitals. As of we're talking today, all the geopolitical zones of these countries have cancer centers.
So in the southeast, you have, in the northwest,
we have in Enugu, in the northeast, we have UMTH Maiduguri Teaching Hospital. We have in Gombe, 2 in the northeast. In the southwest, we have in Sokoto, we have in Kano, we have in Ebu Teaching Hospital, fully equipped. Standard medical equipment with expertise available
cancer to treat, up to stage level 4. To
treat cancer, to do radio diagnostic, to do radiotherapy,
and
post-therapy, post-curative therapy, post-rehabilitation. They are all available in Nigeria.
But they're subsidized?
They are fully subsidized. In fact, let me tell you something, Shane. They are not just subsidized, but they are free.
Really?
They are free.
In all of the centers?
In all of the centers, they are free.
But the waiting list is going to be very long.
We also have 12 centers, 12 tertiary institutions in Nigeria today that we went into partnership with the private sector, which through government had dedicated what we call the Cancer Health Funds. And they are free. You enroll on it free.
Where can we get this information? Is there a website, or where can we access
the information is available in the Federal Ministry of Health. So what we need to do is to intensify awareness creation. Nigerians don't even know in communities. We need to intensify. Even National Hospital here is a cancer center. And they also have the Cancer Health Fund that they provide free services to Nigerians. So there is no basis for Nigerians today to travel abroad to seek for medical services for cancer or oncology, if I may call it. It's fully available in this country.
Professor Yamis, you know that Nigeria, and I'm glad that you left your country, and I see a few of you and your colleagues who are here. What attracts you to Nigeria, and why do you think Nigerians are one of the best doctors in the world? I'm very proud of that.
Yes.
My immediate younger brother is one. He's in oncology.
So you get to know more.
Yes, I do a bit of a knowledge share with him on issues of oncology. But why do you think Nigeria is fascinating, healthcare-wise?
Thank you. This is Madam Salma said, okay, Nigeria has many facilities for the cancer, and yes, it's true, but Nigeria is a very big country. Also, the doctor in Nigerian doctor, many high-quality Nigerian doctor is working in USA, in England, and all over the world. And the medical tourism is not only one, the one side problem of the health sector. The other side is, the doctors and the high quality medical persons you must keep here. And okay, there's all over the world, there is a big marketing for the doctor. In Nizamiye Hospital, I have 40 expatriate doctors, but every day they took the offer from the some countries, from the Dubai, so the doctors looking for the best, the place to work, and one side is the facilities, the other side is the the government support, because especially in public health sector, the government's support is very important. I'm very happy to see the last last years the government support public sector and
supporting the
yes,
private sector.
It also affect us as a the support us also.
On a final note, and quickly, Professor Yamis, Nizamiye, for example, is fully ready for the most sophisticated treatment. Is that right?
Yes. Yes, and all departments, for example, interventional radiology, cardiology, oncology, orthopedy, we are giving the high quality medical service because all departments we are using 2-3 doctors.
Yeah.
Nowadays, the medical, the subspecialty is getting, improved.
Professor Yamis, we need to go.
And what the president has
I wanted to say something because we are totally out of time. What would you say to Nigerians who don't believe in this system, that what is changing, just in 10 seconds?
I want them to trust the system and have confidence. What President Bola Ahmed Tinubu did in the last 2 years is to create that enabling environment. Creating enabling environment, and then one of which I must mention, which made it easy for the private sector, is even importation, tax-free importation of medical equipment.
All right.
Big medical equipment are coming into this country without taxation.
I love this kind of conversation when it's good. Professor Yamis of Nizamiye Hospital, Dr. Salman Anas, Special Advisor to the President on Health. Thank you so much for coming in the program tonight.
Thank you so much.
Well, that's our show for tonight, everyone. Thanks for watching. I'm Sean Akibale. God bless Nigeria.